Hi, welcome to my channel. Thank you for returning. I'm working from my kitchen this morning, hence I'm filming in my kitchen. Thanks for coming back. If you like my content, please like, share and subscribe and hit the notification button. That will tell you when I have uploaded content. Now today we are going to do another series in our Nursing Perspective series. And the thing that I'd like to talk about today is how to pass a nursing interview, whether it be a nursing interview where you're qualified and you're going to get your first job, or it is that you are interviewing for university. So it can be any of those nursing interviews. Now, first and foremost, before we even start the video, let's just give yourself a congratulation for being shortlisted for either university or for a job. Well done on being shortlisted. It means that you wrote a stellar application form and you've been shortlisted. Remember that anything that happens to you in life, you deserve it, okay? So let's start. It's going to be 10 things that I think will help you to get that job or get into university for nursing. Now, the first thing I wanted to do, now you've been shortlisted and they send you an acceptance letter. They send you this letter either by email or by letter. Please familiarize yourself with the instructions on the letter or the email. This will allow you to plan ahead by getting all your documentations, identifications, and everything that you will need for the interview together. So number one is read your letter so you've got time to follow the instructions, okay? Don't read it the night before and then they need something that you have to get from college and you're unable to get it because it's the night before. So number two, if you're traveling for your interview, which a lot of people tend to do travel for their interview, find out exactly where the interview is. So check Google Maps, check Transport for London map and directions, any map that you use, check that map, plot the directions. This will give you your travel time in advance and your travel route in advance. So that's my number two, check where you're going in advance. So you know where you're going now, you know where your interview will be kept. Book a train or bus ticket in advance. So if you're coming from outside London, where you might come down on the bus or on the train, book the tickets in advance. Or if you're in London and you're going up to Manchester or Birmingham for your interview, book the tickets in advance. This will save you time when you get to the station. You don't have to be purchasing tickets and then the train is full or the bus is full. Contact your relatives that you might have in that city. So you might have relatives, you're going up to Canterbury. So you might have relatives in Canterbury. Contact them, see if they can have you sleep over for that night, or if not, then see if you can afford a hotel. If you drive or you're getting a lift from a relative, check the GPS to see what the travel time is going to be, because you want to know if there's been any accidents, if there's any road works, all of those things that might slow your time down. So that's number three. Book in advance, book your tickets in advance and check your route in advance. Number four, this is super important. As a person that does a lot of interviews, I'm going to tell you that this is one of the most important things that you can do for any interview is dress appropriately. Appropriate dress is very important. This is such an important step that if you bypass this step, you might not be offered a place or you might not get the job, okay? So remember, first impression is the lasting impression. So when you walk into that room, the interviewers are looking at your dress. No jeans, no t-shirt, your skirt shouldn't be too short. You shouldn't wear shorts. No overly bright colors, no low blouse that's showing your breast, no see-through clothing. Don't be crushed as if you've just rolled out of bed that morning. No dirty stained clothes. And I've put these things in because these are things that people have come to interview and they look like this. So that's where I got my list from previous interviews. So make sure that you're not doing any of those things. The thing to do is to be neat, clean, presentable. So you want to come in something like a blazer and shirt, or a blazer and blouse, Make sure your skirt isn't too short, as I said, and trousers. Wear smart shoes as well. This is very important. Wear smart shoes. No flip-flops, no bed slippers, no trainers, no 20-inch platform heels, none of those things. Just smart, comfortable shoes, okay? You want to give the right impression that you are a professional. So you are stepping into the interview and you're saying, this job is mine, I'm a professional, and I'm acting accordingly. So that's number 4, dress appropriately. Number 5, the night before the interview, pack your bag. So pack your bag the night before the interview. Put all your documents that you're going to need inside, because you would have done number 1, where you've read your letter and you know what is required. So now you're going to pack them in your bag. So you're going to need things such as your driver's license, your passport, your travel ticket, your bus ticket, if you need work permits, your certificates from university and from secondary school or high school, any documents that are requested. Some people will ask you to upload a picture on site. They'll ask you to fill in a letter and bring it with you, fill it in, sign it, bring it in with you. You know, all these different things, you need to have them in your bag the night before. What you don't want is to wake up 10 minutes late the next day and you forget to put your documents in your bag, okay? So that's number 5. Pack your bag the night before. Number 6, arrive to the interview at least 10 to 15 minutes in advance. And that will give you enough time to just take that deep breath, because it's nerve-wracking to interview. So arrive 10 to 15 minutes before, sit down, get your paperwork out, get them together. Make sure that if you need a toilet, you use a toilet. Make sure that if you're sweating, it's summer, you're a little bit sweaty, that you can go to the toilet, bathroom, take off all the sweat, you know, get yourself, spray some water on your neck to calm yourself down. You know, just make sure that your hands and face are nice and dry, and use the washroom if you need it. And this is my personal view, do not under any circumstances do a night shift the night before your interview. So you do a night shift, you finish at 8 in the morning and your interview is 9. Don't do it. You'll be tired, you won't be able to answer the questions, you might look a little bit like you've just rolled out of bed because you've been at work all night. So make sure you never work the night before your interview. The last thing you want is to look tired and haggard with bags under your eyes, and the interviewer is looking at you like, this person don't really need this job. You know, they don't need this job. They're busy doing their job that they're doing now, or they're not prepared for university because look at how they've presented themselves. So that's what you're going to do. You're going to have a good night's sleep, no work, and no bags under your eyes, unless you naturally have bags under your eyes, okay? So number 7, have at least 2 hours to spare. Do not book into 2, 3, 4 interviews on the same day. Now, if you are applying for a series of jobs, because there's no person who will apply for one job, so you're applying for a few different jobs, do not accept interviews on the same day. 1 interview a day is enough. You need to go home, you need to put your feet up, you need to recoup, you need to just relax. So if you have an interview at 10 in East London, and then you've got another interview at 12 in South London, and another one at 4 in North London, it's not going to work out for you. 1 interview a day is enough. So that's number 7. Have time to spare. 1 interview per day. Number 8, be prepared for your interview. Be prepared for your interview. Your interview is an exam. Think of your interview like it is an exam. If you're interviewing to become a student nurse, or you're interviewing to become a nurse, you've qualified and you're being a nurse, know what you're interviewing for. If you're interviewing to be a student nurse, you must know what a student nurse or a nurse does. If you're interviewing for any post, be it in renal, cardiology, whatever community, you must know what they do in that job. Because if you are applying for that job, you must know the job to apply for it. So do know what it's about. Familiarize yourself with that area. You want to read a little bit about the hospital or the community that you're interviewing for. They will ask you things about themselves. Why did you choose us? and you must know why you've chosen them. Why did you choose this trust to work in? And you must have good reasons. It's never good enough to say, oh, I've chosen you because I live 5 minutes away. That's not a good reason. You must have good, solid reasons, and you'll get this from reading. So do look at an interview as if it's an exam, okay? So know your department. Don't apply for oncology and then you're giving answers for respiratory. Know your department that you're interviewing for. Read the hospital visions and values. A lot of trust will ask you, what do you think of our visions and values? And you must know that. So read the hospital vision. You can Google that. Easy Google search. Whatever trust it is, put it in Google and it will tell you what their vision and values are. So check that first. If you're applying for a trust, and remember, trust is usually a group of hospitals. So do find out which hospitals are in that trust, because they might ask you. And if they ask you, you need to know. Because that's something that you really should know if you're applying to work in that area. And know what sort of trust it is. Some trusts are cancer trust. Some trust has a mixture of everything, you know. So do know what the hospitals do. And it's a quick Google search again. So you've made it through. So you have made it to the interview, right? You've made it. You've got all those things. You've made it to the interview. You're on time and you're ready to go. You're prepared. Do keep in mind, a lot of trusts will ask you to do a test. And if they ask you to do a test, it's usually a math test or an oral test or a written test for English language. If they ask you to do a test, you must be prepared. Do your drug calculations. Be up on your drug calculations. Know how to have a few, grammatical things that you've read the night before or day before. Do understand that now they're doing a lot of literacy and numeracy, so they might ask you to do a test. And my advice for the test, practice your drug calculations, because most of the mathematical questions will be regarding drug calculations, so that will help you a great deal. And my final one, number 10, be prepared for all types of interviews. There's more than one type of interview. Read the letter. The letter will tell you what sort of interview it is. It could be a one-to-one interview, it could be a group interview, and it could be an interview panel. A one-to-one interview. Actually, I'll explain them to you, and that will be my number 11. Let's explain that in number 11. In a one-to-one interview, you'll be asked, like, the letter will tell you who is going to interview you. It could be a panel that's interviewing you. You'll ask a number of questions, and a good tip is to research the kind of questions that you think they'll ask you for that area. So if you are applying for a neurology ward, find out what kind of question they might ask you, regarding neurology. And so think about it in advance. Think about what kind of questions they might ask you. You can even speak to the interview board, or you might speak to the ward manager before you interview, and just get a feel for what it is they might ask you. And remember, you deserve that job. You deserve the place in university. Sell yourself, sell yourself, sell yourself, sell yourself. Go there confident. Know your area, know why you're interviewing, and sell yourself. So let's say, for instance, a group interview. Now, group interview, that's how I was interviewed for university all those donkey years ago when I was in university, and it was a group interview, and I never forgotten it. So in a group interview, you will be put in a small group of about 6 people, and sometimes they have you sit on the floor in a circle, sometimes they have you sit on chairs in a circle. COVID time, I'm not sure what they'll do, but it should be similar. And tips for the group interview is, make sure that you talk, but don't talk too much, right? Listen to what other people are saying, because they're looking at skills. They're looking at nursing skills. Talking is a skill, but not overly so. Listening is a skill, but don't talk over people. Make sure you don't talk over people and, shout. Don't make it difficult for other people to give their opinion, because obviously nursing is all about teamwork. So this is where you're going to highlight and utilize your teamwork. So don't talk overly aggressive. And for those who come from cultures that we tend to talk a little bit louder, try and keep your voice down so it doesn't seem like you're being overly aggressive. In other words, just strike a good balance, have a lovely good balance. You don't want to be too timid and you don't want to be too aggressive. And as I say, work as a part of a team. In group work, it's mainly teamwork. So show that you've got leadership skills. They're looking for your leadership skills. Show that you've got leadership skills. If somebody says something you don't agree with, politely tell them how you feel about the situation. So highlight your leadership and your team working skills, and be nice. Just remember, be nice, okay? The third type of interview that it might be is a mini multiple interviews. These interviews are very similar to one-to-one interviews, but it's usually a series of 2 to 3 minutes interviews with various people. So you'll go to different people and they'll ask you different questions. And the people could be like university lecturers, people from the trust. So it might be a nurse from the trust, it might be a stakeholder, it might be a patient, and they'll ask you a different series of questions. I did one of this a year ago, and it was quite an interesting thing because we showed pictures and stuff. So you be prepared for mini interviews. Do your research about the university. Mini interviews are usually university interviews. Do your research about the university. Know why you've applied for that university. Complete your research on NHS on things that they might ask you, like compassion care, that sort of stuff. Be confident. Be passionate. You can't be a nurse unless you're passionate. If you're not passionate about nursing, you will make mistakes and you will lose your PIN number. So be passionate, and more importantly, be yourself. Yes, you're going to be confident, you're going to be passionate, but you need to be yourself, because we want to see who you are as a person. We want to know that you fit into our team. We want to know that when you come to work, that you work according to whatever the standards are. And most importantly, as a nurse, as a student nurse, you must smile. If you're not smiling, then you're frowning. And nobody wants to come into the ward and see a nurse who's frowning at them. Everybody would like you. We're not saying that you should be overly jovial, but you need to smile. So always remember, when you go for an interview, you always smile. And I think this might be number 12 now. Remember to shake the interviewer's hand. It's very important. COVID time, maybe not so much, but after COVID time, remember, shaking hands is very, very important. So I really hope those tips help. I think they will. Actually, I know they will help. So please go through them again. I think I've gone about 13 tips instead of the 10 that I said that I would give you. I hope you enjoy them. And if you do, please share them with others. And it can be for any interview. It doesn't have to be for nursing interviews. It can actually be for any interviews. So if you like my content, please like, share, and subscribe. And don't forget to hit the notification button that's beside the subscribe button. It's a little bell. Click on the bell and it will tell you what to do. And leave a comment. Let me know. Give me some feedback. And let me know if there's anything that you'd like me to talk about in terms of nursing or in terms of book, in terms of anything academic, okay? So thank you for viewing. Please like, share, subscribe, and hit that notification button. Take care of yourself until I see you next time.
My